September was Prostate Cancer Awareness Month, but the topic is so important that it is always relevant. Dr. Neil Shore is the medical director at the Carolina Urological Research Center and is here to tell us more about a therapy for advanced stage prostate cancer. Thank you for joining us.
Thank you.
So before we talk about the new treatment, can you explain some of the background? It used to be that men would just watch and wait to see if it spread, and then what was that called exactly?
Yeah, so there's a lot of variations to the spectrum of men with prostate cancer. So historically, if you had non-metastatic castration-resistant prostate cancer, NMCRPC, we didn't have really grade A, level 1 evidence of a therapy that helped delayed progression for these men. NMCRPC are men who have a rising PSA, prostate-specific antigen, despite being on a hormone therapy to shut down the prostate cancer cells. We get imaging tests like CAT scan and bone scan, it's negative. But now in 2018 to now, we have several new oral therapies that help delay disease progression in a relatively asymptomatic population of men. Nubeqa is the most recent orally approved drug by the FDA. So it's really been some wonderful breakthroughs and advances for this particular population.
So what are some of the treatment goals for those with this form of the disease?
Yeah, it's an important question. What we're trying to do is have these men who have failed their surgery, they're progressing on hormone therapy, the PSA is going up, is to delay disease progression. Because if we can delay disease progression, we can delay symptoms. Oftentimes these men will get terrible bone pain, they may get severe loss of appetite and weight loss, and just general loss of good body function. So delaying disease progression helps maintain a quality of life. And then if we can delay the disease progression, we also delay the need for other anti-cancer therapies. Now, these other anti-cancer therapies are helpful, but they have their own set of side effects that have to be addressed as well.
So how can the available treatment options help patients currently?
So if you can take an oral therapy such as Nubeqa, it's 2 pills taken twice a day, it can delay your disease that would go into bones, that could go into other parts of the body. And when that happens, it delays the onset of symptoms and also the need for other therapies. Ultimately, we're trying to make prostate cancer in an advanced form something that you live with but don't ultimately die of. That's really our goal.
Got it. So what advice do you have for men who are speaking with their doctors now? What should they be asking them about?
Yeah, speak to a prostate cancer expert, and it could be a urologist, medical oncologist, radiation oncologist, but be educated and really know what's going on. This newest therapy, Nubeqa, you can find out about it on nubeqa.com, and there are other great websites as well for advanced prostate cancer patients.
Thank you so much for being with us. Really appreciate it. And we'll be right back right after this. Stay tuned.